Okay.
Okay, should I go ahead and get started?
Yep, go ahead.
Right. So this is our second TMR Restore webinar. My name is Allison McNeil, and I'd like to welcome you. And on behalf of Helen Conroy and the rest of the Thinking Moms Revolution, I'm glad that you're joining us for today's webinar called Leaky Gut, Brain and Body, Dealing with Allergies and Environmental Challenges. In today's webinar, Dr. Zach Bush will be focusing on the use of the supplement Restore for chronic disease and environmental and food allergies. We have an incredible giveaway today for a member of our live audience. At the end of the webinar, we will be giving one participant a year's supply of Restore. That's 4 of the large bottles. So if you're watching live today, you're eligible to win. And we will draw our winner randomly at the close of today's presentation. Welcome, Dr. Bush. I'm
Thank
just
you.
going to give you a brief bio, and then I'm going to turn the talk over. Dr. Zach Bush is one of the few triple board certified physicians in the U.S. with specialties in internal medicine, endocrinology, and palliative care. His achievements include award-winning cell biology, clinical care, and medical education. He is the founder of Revolution Health Center in Scottsville, Virginia, and is the CEO of Biomic Sciences, the team that has brought forth the novel science and product line Restore, which we're going to hear about today. Zach is going to talk for about 40 minutes, and then we will have approximately 20 minutes for questions, and you may enter your questions throughout the presentation, and Dr. Bush will take them at the end of his talk. So welcome, Zach, and I'm very much looking forward to hearing your talk today.
Thank you. I'm delighted to be back with you guys. This TMR group has been a phenomenal voice piece for the science that is coming out of our community here in Virginia. We are excited that the science goes far beyond the product, and we've been really thrilled to see the impact of this science as it's been embraced by so many of the TMR moms and families, and it's been a real humbling experience for us to see the incredible intelligence and depth of knowledge of this community you have. You continue to amaze us with the depth of your reading and investigation. Your knowledge certainly surpasses the majority of physicians in America in regard to your mastering of the information out there regarding the links between gut health and the blood-brain barrier and the underpinning mechanisms by which autism occurs. So it's been a wonderful experience to be involved with you all. We certainly appreciate all of the effort put towards the information you upload back towards your Facebook page and everything else. So for those of you participating in TMR, if you haven't seen the TMR Facebook page regarding Restore, please do go there for a lot more wealth of information, and it will really expand your horizons as far as what I can share with you on these webinars. Many of them others are going far beyond that. But the content of seeing what's happening to your children and all of the individuals being put on Restore has been a real joy to us and a real humbling, again, experience. Many children undergoing incredible transformations just in the days and weeks following product integration. We also understand that there's always a large group that have challenges of starting it, and that has a lot to do with how Restore interacts with the real root cause of what's happened to these children and to the really community at large dealing with inflammation and leaky gut. And so when you have a really profoundly affected gut, it can be challenging to get onto Restore, and we're going to talk about that a little bit today in our subject matter here. The subject matter that we're going to cover today is really getting at the interface between this leaky gut phenomenon and the brain. We've talked about the blood-brain barrier and its impact in our last webinar, and we're going to look beyond that to the full body this time and understanding how leaky gut can permeate the entire system with an inflammatory syndrome and really start us down this pathway to accumulating toxins. And this whole phenomenon leads to an incredible burden of allergy and environmental insult, not just in our autistic children, but as a community as a whole. And so we're going to look into those details now as we go forward here. And what I would like to do here is I just messed up my screen, so just give me half a second here. Okay, I've got that piece figured out there. And I'm just going to get my dock out of the way so that I can see. Okay, so we're going to go ahead and start into kind of the overview here and where things start. And what we can look out into the community and see clinically in our clinics here in Virginia, we see this day in and day out, that we have an acceleration of disease and the aging process itself in our population. And at the very root, you can really see this boil down to two major pieces clinically, and that's dehydration and nutrient deficiency. And so as we age, you can go to a nursing home and see this phenomenon where almost every patient is dry as a chip. They have dry mucous membranes, dry mouth, and they have lower extremity edema or swelling in their legs. And so they have a situation where none of the water in their body can actually get inside the cell. What you can't see quite as well is that the same phenomenon is happening with nutrients. The nutrients that they're being put in their body, albeit a poor nutrient source in a lot of these nursing homes and everything else, of course, but the nutrients that are put in their body, as well as the water, don't get to their target, which is the cell, which is where it will be turned into fuel for cell repair and cell metabolism, burning of energy, etc. And so the aging process can really be boiled down to these two phenomena of intracellular, inside the cell, dehydration, and loss of nutrients. In the end, what you're not seeing but getting a sense of in that aging process is this loss of cellular communication that then follows. And the loss of cellular communication is now starting to be better understood as we have the science behind Restore and other mitochondrial metabolism understandings of redox molecules. And so these positive and negative charge molecules are really the heart and soul of how cells find out that they're damaged and how they need to repair. And so as there's less and less nutrient being handled by diverse bacteria, and as there's less and less nutrient getting inside the cells for the mitochondria, there's a steady loss in these redox molecules, which are the mechanisms or the communication network of cell repair. And so this is the phenomenon that we see across the population, and in this group here with TMR, you get to see this in a very accelerated fashion in an autistic child. And so the autistic child from the get-go is having a very difficult time getting nutrients and water inside the cells. So this is kind of the underpinnings of disease if we see it. And the interesting thing is looking at the acceleration here. This is a sad and almost terrifying thing in clinic where we see this 10 to 20 year jump from generation to generation. Grandma developed type 2 diabetes at age 65. Daughter developed it at 45, and now they have a daughter who's got polycystic ovarian syndrome by 15, and by 2025 she's got early type 2 diabetes. And so that 20-year jump that we're seeing from generation to generation is going through many disease processes. And now, of course, you guys are familiar with the CDC's report in 2005 that predicted for the first time in American history that our children born after 2000 would be expected to live shorter than their parents. So the first generation would be expected to live shorter than the parents in American history. And so we're in a stunning state of decline, and we're going to take a look at some of the kind of shorter-term sequelae of that at the clinical side. And so we showed this at the last one too, but it's always worth kind of coming back to the reality of that autism at 1 in 68, most recent publications coming out in 2012. We assume that number has gone down, so we're probably at 1 in 60 or below now. But that's really the tip of the iceberg. This huge, massive inflammatory cascade that goes down through the lifetime. We're going to touch a lot on asthma and allergy, the next two on the list today, at 1 in 12 and 1 in 4 in those two disease processes there. And frankly, the numbers can be much higher depending on which country you live in. And we'll come back to that piece as well. So we have just this huge burden of disease, and every one of us on the call are currently being affected by that chronic leak, dehydration, lack of nutrients, just albeit in a slower fashion than those autistic children. But this is giving you kind of a glimpse over the lifetime or lifespan of the individuals as to what we can expect as we continue to experience that same cascade in our own body. So at this point, all of you are probably very familiar with tight junctions. Many of you were familiar with tight junctions and leaky gut and leaky blood-brain barrier before you met us at Restore. But I hope that we've brought your understanding in science to a whole nother level of understanding there. And that tight junction science now is really accelerating on a daily basis. You can't go through any peer-reviewed journal article and any publication in the country right now without running into something about leaky membranes and the microbiome of the gut and the interplay therein. And so we're going to take a look at the impact on these tight junctions on the greater body here. We focused a lot on the last talk around the gut and the blood-brain barrier and general inflammation, neurologic injury, etc. But now we're going to look at more of that insidious process of inflammation as it goes into the body. The gut is just the beginning of it, and as nutrients absorb across that, they ultimately will go into the bloodstream. And it turns out that each of those blood vessels, both the arteries and the veins, are tied together again with tight junctions. And so each of the endothelial cells that make up a blood vessel tied together by tight junctions. And so your children with autism are just a more quintessential example of what's happening in all of us, which is leaky blood vessels as well as leaky gut. And so as leaky blood vessels turn out to, again, undermine the intelligence of the membranes. So as you break those tight junctions, you lose intelligent distribution of nutrients. There should be a very careful and regulated process of getting nutrients from the bloodstream into tissues, and it should be much different for any given tissue. So your kidney or your adrenal gland or your thyroid or a lung tissue should see much different levels of some nutrients and not others. The brain probably being the best example of kind of the holy grail, or the holy of holies, as it probably better stated there, the most regulated environment in the body. As those veins and arteries start to leak, tissues start to be engulfed in nutrients and particles that should not have been there, and a lot of tissues downstream are not going to receive those. So you've got an overwhelm in some tissues, and you've got a depletion going simultaneously in other areas of the body because of this big vascular leak. You guys are well aware of that whole inflammatory brain and everything else that happens as we start to develop early signs of that. We get anxiety and depressive symptoms in teens and adults. As the inflammation increases, we get attention deficit, which can be quite severe. And then, of course, the whole autistic spectrum as well. So that ASD is kind of the end of what the rest of us, or kind of the maximum impact of a syndrome that's starting at a much lower level in all of us. In addition, we want to think about, as we talk today, the reality that the kidneys, our main clearance pathway for many of the acids that will accumulate in our body, as well as other toxins, such as the heavy metals and stuff that you guys are so aware of in your children, those kidneys are really reliant on those intelligent membranes. The kidney is one giant blood vessel, if you will. It's got all of these complex loops of blood vessels that lead to the ability to absorb, secrete, and reabsorb water and other micronutrients, electrolytes, etc. And so that intelligent membrane is perhaps most important in the kidney when you talk about the blood vessel tree. And so a leaky kidney or an unintelligent kidney membrane is going to lead to the difficulty of getting toxins out of the body. And so when you get this widespread vascular injury, your child literally turns into, or you turn into, a dry sponge for toxin, and your body starts to accumulate and accumulate and accumulate. The front gate is wide open because you got no tight junction to protect against whatever's going in the mouth, and you got an impaired clearance system. And so because of the leak combined with the intense difficulty of clearing, you've got yourself a perfect storm. Tight junction toxins and injury, we can go through kind of a quick list. We've talked a lot about what's perceived currently as the public enemy number one, perhaps right now when we think leaky gut, and that's glyphosate, which is the compound that's in most of the weed killers on the market now. And that glyphosate is second only to cholera toxin. Cholera is only one of the many organisms that can put out tight junction toxins. Cholera toxin kind of started the science with the discovery of zonulin occludin toxins and the production of zonulin at the intestinal wall, which breaks down those tight junctions. That zonulin toxin pathway is triggered by cholera, but we also see it in a lot of other things that are more endemic in the United States, such as Clostridium difficile, which is a very common hospital-acquired infection of diarrhea, C. diff. That diarrheal illness is the perfect example of the dehydration event of leaky membranes. If you cannot absorb water effectively across the colon, you end up leaving all of the water from your food and hydration effort in the colon. You end up with watery diarrhea. And so, same thing in a more insidious way happening in your autistic child as leaky gut develops from a number of different injuries. They get leaked, and so that water is left in the colon. They get chronic loose stools and the rest that you are so familiar with. So we got bacteria there as insults that can happen. We've also got the pharmaceutical world. So antibiotics in our children are probably one of the hallmarks of breakdown in these tight junctions and the barrier system. Almost every patient that ends up in my clinic, I can sit down with them regardless of what complaint they come in with, whether it's irritable bowel syndrome, inflammatory bowel disease, asthma, allergy, cancer. I can always sit down and dial it back to a history of intense antibiotic exposure at some point in life. And so antibiotics probably frontline or the front injury in the pharmaceutical world, but another extremely common one is the non-steroidal anti-inflammatories or NSAIDs. This is the ibuprofens and all of that on the market. All these anti-inflammatories, if it's not Tylenol, then it's going to end up probably being in one of these. So even the Allegras, or I'm sorry, not the Allegras, the Alleves, and things like that are these non-steroidal anti-inflammatories. So lots and lots of money spent every year. It's one of the biggest categories of over-the-counter expenditures in the U.S., and all of these drugs have direct tight junction effect or toxicity. Going beyond that, other medical interventions, there's a startling bit of information coming out over the last couple of years around ultrasounds and the ability of that ultrasound vibration to disrupt tight junctions, and it really brings into question of what we're doing with all of this routine ultrasound, fetal ultrasound, especially because fetal ultrasound is now being promoted as a frequent thing instead of just your 122-weeker. There's a lot of hospitals that are pushing more frequent OB ultrasound starting as early as 7 weeks in the children, and then pushing on through the 40-week pregnancy. Probably not good for the tight junction environment, blood-brain, and beyond. So a lot of early data there that needs more exploration to really tease out how that's played into our epidemic of leaky gut phenomenon and leaky brain, etc. in our children as early as neonatal life there. And then the nutritional things. There's a lot of focus on gluten in the industry right now, a huge epidemic of gluten sensitivity. And if you've heard enough of my talks, I think you've got a sense that gluten sensitivity is just a symptom of all of the rest above that you see here, probably starting with the glyphosate compound in our diet really being the beginning of gluten sensitivity in our larger population. But there's other compounds in the diet as well. There's needs to be a lot more attention paid to the processed oils, especially the polyunsaturated oils. These polyunsaturated processed oils from vegetable matter and beyond have a direct toxicity to the tight junction as well. And so you can imagine, wow, it's not just gluten sensitivity. Most of those refined and packaged gluten products on the market will also have a polyunsaturated fat or oil source in them as well. And so we're really creating food products now that are just perfect storms for the tight junction. And it goes way beyond the gluten. Every bite of food's got the glyphosate compound from the weed killer, and so many bites of food have those processed oils in them. And so really a devastating effect of our food chain on that gut lining now. I want to turn our attention then to the immune system. And so we didn't talk a lot about that in the last one, but the immune system is now really the first thing to get hit. And so way before the blood-brain barrier and inflammation downstream there, that gut lining is really the bulk of what's happening in the chronic inflammatory state that we think of when we think of leaky gut. The colored picture here is one that demonstrates the villi in the intestines, these finger-like projections. The surface area of the total gut, as you have heard, is between 1 and 2 tennis courts worth of surface area, massive surface area to that gut because of these coral-like projections that increase surface area. That obviously increases the bioavailable surface, so more nutrient can be absorbed, more water can be absorbed, etc. And sitting right in the crypts, or the internal portions of these finger-like projections, is the immune system. And so in a cross-sectional slice of the gut, here's the lining of these gut layer here, or the epithelium, these finger-like projections, and the very outside layer there is those epithelial cells that are tied together with tight junctions. And so that huge epithelial membrane tied together with tight junctions is what is the ground zero of this kind of nutritional and pharmaceutical and agricultural injury. Sitting right behind that is this series of lymph tissues, and this as a group is called the gastrointestinal associated lymphatic tissue, or the GALT. And so the GALT represents 80% of your immune system. It lines everything from your sinuses all the way to the rectum, and it's looking for insults. And so that huge volume of lymph tissue actually produces 80% of the antibodies in your entire body. And so this is getting at really what we're seeing as an epidemic here, and we're focusing on today, is the story of food sensitivity, asthma, allergy, eczema, and ultimately autoimmunity being a further downstream event that we expect to happen as that mess proceeds. A couple thoughts on the difference between sensitivity and allergy, and this is important and speaks to a lot of the questions that are out there around allergy in autistic kids. A sensitivity is one in which inflammation occurs because an inappropriate compound gets into the gut lining or into this GALT. And so an example of that might be something like an insoluble fiber. Insoluble fiber is generally supposed to stay in the gut lining, or outside of the gut lining, rather, is supposed to stay in the intestines and secrete with your stool. But if leaky gut occurs, especially in an injury as broad and as deep as we see in an autistic child, something like a simple fiber from kale or Brussels sprouts or healthy food can end up being a noxious kind of inflammatory reaction. So this is not where an antibody is formed directly to that fiber, but it gets in there and it requires your immune system to activate and deal with this foreign substance. And so you've got macrophage, which are sweeper cells in there. You got all kinds of debris management going on. And so that's where sensitivity comes, where you eat a food, you get some bloating, you get some pain, but there is no specific antibody formed to that. An allergy is where you get a direct, specific immune reaction through an antibody pathway, which can be linked to a histamine reaction or may not be linked to a histamine reaction. But most allergies that we recognize do have a histamine component. The histamine can cause anything from that bloating and pain, again, on a severe level, all the way down to hives, rashes, the spasm of the lungs, that would be your pulmonary system, giving you the asthma-type syndrome of wheezing, cough after food, etc. The most severe end of that spectrum, of course, being anaphylaxis, which we see with peanut allergies and the like. The importance clinically of a sensitivity versus an allergy is really down to what we would think of as the necessary treatments involved and the time to recovery. If you have a sensitivity, as soon as you slam shut that gut wall, you can actually resolve that sensitivity. So we get to see this often in our gluten-sensitive patients. As soon as the tight junctions are supported and promoted by Restore, within weeks to months, you got somebody who's eating pizza or eating gluten sources without the bloating and everything else. And so your sensitive population can be very fast, days to weeks, in responding to that support because of the fact that all they were lacking was that front line of defense. As soon as the door shuts, there's no persistent inflammatory process underneath the surface. In contrast, your allergy patient, something like a peanut allergy per se, they've got antibodies that are now being produced and secreted out into the gut. And so they, perhaps a better example would be your celiac patients now. So you have your gluten-sensitive patient that responds very quickly, and then you have your celiac patient. Your celiac patient is making a secretory IgA, or antibody that actually moves from the gullet out into the intestinal lining and can actually activate and bind gluten sources, namely gliadin, which is a breakdown product of gluten, even in the gut wall, or inside the gut lumen, rather. And so it obviously takes longer for somebody who's built an antibody to a peanut or to gluten to resolve their syndrome than it would if they're just a sensitive patient rather than an allergic patient. Autoimmunity is then the situation where one of those antibodies that's formed in an allergic type setting cross-reacts with some sort of endogenous tissue within your body. And so thyroid is certainly the most common of those. In screening, even around 1998 and 2000, working in academia at the time, and there was a nice study that we did that looked at universal screening there. And in 100 girls ages 12 to 13, full 25% of them already had antibodies to their thyroid gland, even though most of them were asymptomatic at the time. And so that was 1998-2000. That was right at the very beginning of this epidemic of autoimmunity. We are way beyond that, and it wouldn't surprise me if we're up in the 35 to 45% of young girls eliciting antibodies to the thyroid by the time they're 18. So really a big epidemic of that autoimmunity going on. With Restore clinically, as you close the gate by promoting strength in those tight junctions with Restore, you do see a sudden and rapid decline in antibody levels, but it can take as much as 1.5 years or 2 to get people back near normal range with their antibodies for something like thyroid. So if you've got an allergy or if you've got an autoimmunity, even when you shut the gate, it's going to take a good long while for those antibody levels to drop and the clinical syndromes to completely go into remission. So that's kind of the natural history of the two, sensitivity versus allergy. Once that immune system is hit, you've got the gullet revved up, you've got that chronic inflammation event starting to happen. And the acute inflammation to chronic inflammation transition happens when you start to overwhelm the resources of antioxidants at the tissue level. And so the tissue level should really be well prepared for injury. There should be a very large amount of coping mechanisms down there at the tissue level. And that's where a sudden injury should trigger this response and should be cleaned up within a matter of minutes to certainly hours from the initial hit. If we see chronic inflammation starting to form, we know we've overwhelmed those antioxidant reservoirs and those coping mechanisms, and we're starting to get snowballing oxidative stress from the immune system itself. So the injury happens, the immune system responds, oxidants are dumped by the T cells, that oxidant can't get cleared, so it becomes another natus for injury, and you get this snowballing reaction that turns into arthritis in the knee, or autism in the child's brain, or chronic allergy, as it may happen. And so these are the syndromes that we see stemming from that chronic inflammation as we get continued depletion of reservoir or reserve in that gullet lining. You can imagine if you've got leaky gut and you've got this huge constant injury going on, that you're taking away systemic resources for antioxidants, etc., from the rest of the body. And so it's not unusual for somebody to start Restore and see almost an immediate improvement in knee pain from their arthritis. My current belief is that Restore does not at all treat arthritis. Instead, it simply frees up resources as the tight junctions are supported to the gut lining. It frees up resources systemically to go manage inflammation elsewhere as well. And so a nice kind of sense of once you close the gate, your reservoir starts filling back up and you've got coping mechanism. Some of the reports that we see in our non-autistic as well as our autistic children is sleep quality, and this is a big one. And so when there's neurologic stress and inflammation, sleep quality is one of the very first and most sensitive markers of impairment. And once you start shutting the gate with Restore, a really quick restoration of normal sleep patterns can be seen. We have many adults who are taking the product that have reported that they didn't even know what sleep felt like until they were a month or two into tight junction support with the Restore. All right, let's take a look at what we mean by allergy and environmental injury here. This is just from the 2-year period of 2009 to 2011. This is in the United States, and this is again sourced from the CDC. These are the percentage of children ages 0 to 17 with a reported allergic reaction in the last 12 months. And so take in mind there are probably 10 to 20 to maybe 100 individuals that will have an allergic reaction but not report it because, well, they just know they have seasonal allergies or they just know they have food allergies, so it doesn't get reported. But this is that small segment that actually ends up getting reported to a physician and logged in such a way that it could end up in a clinical study from the CDC. These are questionnaires that are sent out and responded to, basically. And so this is probably way underestimating the actual percentage affected, but you can see that there is age trends in all of these. The food allergy is very consistent, around 5% in the United States. Again, this is probably underestimating total prevalence, but it's interesting that from age 0 to 4 to age 10 to 17, those rates are very similar. In contrast, while a full 15% are reporting skin allergies, and the most common one here is eczema, the dry, scaly, itchy skin pattern that we see that can happen inside your elbow pad there in the antecubital fossa, behind the knees, common spots, etc. So highest in your youngest children, and many of you have probably seen your kids outgrow eczema, and this has a lot to do with the types of antibodies and T cells that are present at age 2 versus age 15. And so the skin allergies stuff seems to decline over time. In contrast, as you can see here, there's a marked increase over the lifespan there of the child with the respiratories. The respiratory complications can be nasosinus is the most common one, with what we call rhinitis or runny nose and postnasal drainage, and that is usually from environmental stimulus, from anything from dust to pet dander to dust mites to the seasonal effects of molds, pollens, spores, etc. And so that chronic nasal drainage, chronic postnasal sinus drip, all of that is going to be lumped into this respiratory section, and then it does expand into the asthma syndromes. And so rhinitis and asthma kind of being lumped together there, and that is really happening, as you can see here, in almost 23% of children 10 to 17 reporting some sort of chronic respiratory stuff by the age of 17. So really high prevalence in our community. And in the United States, we seem to be, you would think we would be the worst, but in fact, among developed countries, we're actually ranking like 5th or 10th, depending on which ranking you look at, depending on which condition here. But the nation that is leading the pack in the highest amount of food allergies and respiratory symptoms is Australia right now. Australia is actually running about 3 times that of the United States in regard to allergy and asthma. So really profoundly high numbers there. And that, again, has to do with the enormous agricultural environment there in Australia and the enormous amount of cheap glyphosate being dumped on crops throughout the country there, glyphosate being provided through cheap streams coming out of Asia there. And so U.S. showing high numbers here, but depending on which developed country we look towards, we can see much, much higher levels. Regardless of what country you look at, it's clear that the prevalence is increasing. Current estimates are that we have increased 30 to 50% the amount of allergy that we see, both food allergy, respiratory allergy, etc., over the last 10 years. And you've got to remember that the epidemic really started more like 30 years ago. And so if we look back to 1940 versus today, we are logarithmically increased in the amount of food allergy, asthma, etc. that we have in the community. All right. A thought quickly on food sensitivity testing. Many of you have done this for your children. Many of you have done this for yourselves. And you've sent off a blood test, typically, and that blood test comes back with an enormous spectrum of food sensitivities, and you end up with 5 pages of foods that you have variable amounts of sensitivity to. I have stopped doing food sensitivity testing in my clinic, and largely this is because it's become such an easy and predictable outcome of that. Basically, you can ask yourself, what are your favorite foods, and you can bet on your food sensitivity algorithms. Those are going to come up fast and high on your list of most sensitives. And so it's not unusual for you to get that and you'd be like, what? You know, cashews are like my favorite food. I eat them all the time. How can I possibly be sensitive or allergic to them? Basically, it comes down to if you have a leaky gut, your food sensitivity testing is always going to likely reveal many of your recently consumed foods. And so if you are consistently hitting your gut with cashews or almonds or whatever it is, or kale or your green smoothies, all of these have compounds that can, in a leaky gut, affect a positive result in food sensitivity or in allergy testing. And so with that knowledge, you start to realize, wait, the food sensitivity, the food allergy is not the cause of my problem. And I think that's an important shift for us to make as a community, is realize, okay, my kids are not just food allergic. That's not why they're autistic. That's not why they have attention deficit. That's not why they're dealing with irritable bowel syndrome. The food sensitivities are simply a symptom of that leaky gut, introduction of food inappropriately across that membrane into that gullet and inducing that inflammatory or immune reaction. So the food sensitive testing is a symptom, and I've stopped testing for it largely because it would be much like my patients coming in with a viral infection. Instead of just managing their virus and the downstream effects of that, instead I would be measuring the amount of snot they make every day or something like that. We've got to stop focusing on the symptoms and really move towards more and more understanding, okay, everything that we see in the human condition right now, if it's not health, then it's a lack of health. It's not a disease process. We need to stop thinking about anything as a disease process, whether it be celiac disease or gluten sensitivity or autism or what have you, cancer down the line. Everything needs to be started to be understood as a symptom of a bigger injury and not really a root cause disease process. And so that's where we move as a clinic, and that's where you guys as a community of TMR are already moving quickly with your understandings. Seasonal allergies and sensitivities. This, again, there's a big allergy panels you can send off, and again, you're going to be coming up with the stuff that is most likely to be hitting you a couple times a year in your area. Here in Virginia, we see a lot of ragweed allergies, and it's because we have a lot of ragweed around in spring and fall. So it's just kind of a no-brainer. Why bother doing all this prick testing and skin testing and everything else if you know exactly what you're going to come up with? And so the dust, the cat dander, the molds, the pollens, those are just predictable things that you're going to be reacting to because you have leaky membranes. And again, your leaky membranes are not just at the gut down in the intestines. It starts at your nose. And so from the nose into the sinuses, your postnasal pharynx there, back of the throat, all the way down into the lungs, all the way down into the gut, all of that is tight junctions. All of that is becoming vulnerable to insult from your environmental inhaled compounds. So how are we going to start reducing allergies? The typical thing is we can just think back to that cascade of what caused the tight junction injury first. Certainly getting antibiotics out of the routine is a critical piece. All of you at TMR are very well aware of this and don't need to be told. But again, a look back to the very beginning of this syndrome. Many of you that have come to my clinic with your kids, again, have pointed back to, boy, they had recurrent ear infections and all of these signs of immune dysfunction when they were young. That got them hit with antibiotics over and over again, and now this cascade has happened. And so antibiotics need to get out of the equation as much as possible, and I think it's an extremely rare event where a child actually ends up needing antibiotics. Ibuprofen and other NSAIDs need to absolutely not be used in children. I really try to get all of my adult patients off these as well. I think it's a critical piece to long-term health is stopping the constant insult from these anti-inflammatories. But certainly they should not be used in a pediatric population. Alcohol, not so hard to avoid, obviously, in your pediatric population. But I think that as parents, especially when we're stressed parents, this is a drug we reach for to self-medicate, take the edge off after a very stressful and intense day of dealing with children that are compromised and are under duress all the time. It just takes it out of us. So as parents, we can encourage each other to look towards other sources to take the edge off for us and remember that, wow, that alcohol itself is inducing a leaky gut phenomenon. you need to take care of yourself as parents as well as that you can be there for your kids and in the future as well. And so next one, looking at the cooking patterns, processed cooking oils, things like your GMO canola oils, etc. Not only do they have high amounts of glyphosate potential in them, they also have that direct toxicity with the polyunsaturated fats hitting the gut lining and direct toxin to the tight junction. I also very much encourage my patients and their families to get microwaves out of the house. Microwaves have a way of breaking bonds, and this can happen in a protein. They can lead to protein structure changes that can be highly inflammatory and detrimental, but they can also break the bonds in oils and take a monounsaturated fat to a polyunsaturated fat, etc., and can damage what should be healthy food. And so getting those out, very cheap thing on the market that you can replace your microwave with and keep a lot of the convenience is the infrared ovens. The infrared ovens don't seem to do the same damage to the food at that bond level, that molecular bond. And so the infrared ovens usually run about $80 or something like that, and they're easy. Sit on the countertop and hit the button and warm your food up for 3 to 5 minutes. They can do a lot of things as far as quality of cooking food that your microwave can't do. You can brown. You can actually get a kind of more of a broiling effect through infrared instead of just creating a soggy, hot thing. You can actually get a crisping effect from your infrared oven. So a better output from a nutritional standpoint, better output aesthetically, and from a gustatory sense. Lots of advantages for the infrared ovens. Eat organic is obvious. It's one that you guys have already been doing a lot of and focusing on in your children's health efforts. The Eat Organic effort, it can be simplified a little bit through one of the few really helpful government websites, which is the Clean 15 and the Dirty Dozen. That website is outlining those 12 vegetables that are most highly sprayed with weed killers, pesticides, herbicides, etc. And so those would be the 12 that you really want to go after. Those include things like your cucumber, your potato, etc. And so you go to that website and make sure at least the Dirty Dozen you're getting in an organic fashion. The Clean 15 are crops that are not as critical to get it organic because they are low spray crops just by the nature of their conventional farming. All right. Further efforts then to reduce allergies, looking at the lifespan. Really critical thing about health of the mothers while that child is in utero. Avoiding tight junction injury, I think, is critical. Everything from decreasing the use of ultrasound during pregnancy to making sure mom's not on non-steroidal anti-inflammatories, reduce alcohol intake. All of these things can make sure that the baby's got the best shot at getting that certainly organic food throughout the pregnancy. We have a lot of mothers pregnant and nursing that are on Restore, and have had great results with that and keeping healthy throughout their pregnancies. Obviously, leaky gut during pregnancy leads to systemic issues for the mother. A common one is gestational diabetes as a result of that leaky membrane and liver inflammation. So lots of reasons for mom to be targeting those tight junctions and avoiding toxin and really trying to support the tight junction with a good environment. Breastfeeding. There's been many, many studies over the years looking at the use of breastfeeding to reduce allergies in infants and children, and that breastfeeding is unfortunately diminishing in its efficacy. What we can see now is that it's still an advantage for a mother to breastfeed if she's in a developing country where there's not much in the way of weed killers being used. The breast milk clearly promotes a healthier immune system, reduces asthma, allergy, etc. Unfortunately, in the developing world, we've seen that benefit erased over the last few years, and that's probably because of the new realization that there's a bioaccumulation of glyphosate, it looks like, the weed killer in breast milk. That was Moms Across America, one of your sister-like organizations here that paid for that small study to be done. That study needs to be repeated in a larger population for us to understand how broadly this is affecting the population and everything else. But it is a stunning realization and maybe pointing to the reason why large studies like the ISAAC study, the ISAAC study here in the United States, has recently demonstrated, oh my gosh, what happened to our breastfeeding advantage that no longer is protecting our children. and it may be that the breastfeeding is now feeding into or is no longer able to combat the leaky gut phenomenon because the glyphosate is right there in the breast milk. I very much strongly encourage all my mothers to continue breastfeeding because there's other advantages outside of this to it, and so certainly the best thing we've got. Eat organic, again, easy for mom, easy for the child as they start eating. Get that dirty dozen out of the house and make sure those are run organic. Eat low on the food chain. My whole clinic really preaches a plant-based diet. The higher you get on the food chain, i.e. the larger the animal or animals versus vegetable, the higher you get on that food chain, the more toxin you're going to have. Everything from heavy metals to like mercury in your fish, etc., all the way to plastics in the ocean and in our fish population. The level of plastics and plastic compounds being measured in salmon and tuna, these large predatory fish, are extremely high now. And so eat low on the food chain is always a good call when it comes to reducing allergy and injury to the gut and accumulation of toxin. Vitamin D, nice studies looking at the interaction of vitamin D supplementation and the downstream effects of this immunity issues at the gut lining. By supplementing your children age 2 and above, the study looked at 2,000 international units a day for 2 to 5-year-olds. There was an 85% reduction in the incidence of type 1 diabetes in that population with just that small amount of vitamin D. So an important one to help. It doesn't protect the tight junction, but it does help dampen the reactivity of the immune system behind that junction and the gult. L-glutamine has long been used to help support membranes. It certainly doesn't combat glyphosate like we see with Restore, but it is a common one that's reached for. We don't use it much in my clinic except for my cancer patients because chemotherapy is one of the real clutch things to destroy tight junctions in the microbiome, and it depletes glutamine directly. So unfortunately, there's a total body depletion in glutamine when you're on chemotherapy, and so for those patients, we push very high levels of L-glutamine. Saturated fats, coconut oil, and bone broths have all been used to help support membrane potential and add a lot of the substrate that we need there. And so I would encourage you to consider keeping the coconut oil in. Bone broths, I think the debate's out yet. I think that we're going to find out that coconut oil is actually better than bone broth in the end, but certainly wouldn't be opposed to the continued use. Many of you are already using these because of the CAPS diet, and probably one of the reasons why you've seen from that GAPS diet in your children. Finally, supporting the bacterial biome diversity using fermented foods. We were just out in Santa Barbara lecturing at the fermentation festival out there. Really exciting group to look into out there. They have a number of events happening around the country now. So look towards a fermentation festival in your area to get a new download of kind of increasing your microbiome through your kitchen. Short-term probiotics we can certainly look to. We are strong proponents of discontinuing probiotics once on Restore. You don't really want more than 2 to 3 weeks of probiotic in general. They create monoculture with chronic use. They boil what should be a 30,000 species reservoir in your gut down to just a few species. So we're a big fan of keeping that short. Travel is huge. The more environments you breathe in, the better you're going to be in your microbiome and support those tight junctions. Huge fan of having pets in the house. Dogs in particular seem to have an extremely beneficial impact on the microbiome and can decrease the amount of allergy in your environment. Here again is a look at the final piece of how do you prevent allergy and sensitivity. In the end, you want to close the gaps. And this is taking a look in the left-hand upper corner here with your control small intestine of the human. The green is highlighting your tight junctions with an antibody that targets something called ZO1. It's a protein within the tight junction. You can see that even in this healthy control, you've got gaps in the tight junctions. If you hit that membrane with the gliadin, that is a byproduct of gluten, you get an immediate injury. You get the big flush of green inside the cell, and you get a breakdown in those membranes to the point where you have these large gaps between the cells, and that's profound leaky gut under the microscope. That gullet is now exposed to absolutely everything you eat, and it's absolutely inevitable now that that gut is going to result in sensitivity and allergy and ultimately autoimmune disease in that subject if that's not repaired. Control membrane, you put Restore on it, you get an incredible increase in those tight junction expressions. You zipper those things tight, and then with the Restore on the membrane, you can add the gliadin at the same dose and see that you can maintain those tight junctions. This here is the top of another cell that's below the foci point, and so you've got everything zippered up tight again, despite the insult of the gluten. We've done this study now with glyphosate many times. Glyphosate we can now take to 20,000 times the amount, 20,000 times the toxin level recognized by the EPA, and despite that huge insult, continue to do 100% protection of the tight junction through the promotion of normal tight junction enzyme pathways, DPP4 enzyme and the rest. And so really exciting to be able to zipper everything shut, keep that door shut, keep the gullet clean. How do we deliver Restore? You guys have all been trying oral. Many of you have also started using it nasally, and I would encourage everybody to try this. If you haven't tried it, you should try this, because all of us are dealing with some degree of postnasal drainage and inflammation in the nasal passages. Simply take your neti pot with your 6 ounces of water and your 1/4 teaspoon of salt, which would be your typical neti pot regimen, and just throw a teaspoon of Restore into that once or twice a day, and you end up with a much different nasosinus health, tighter tight junctions, less postnasal drainage, better sleep quality, and the rest. We're also coming out with a nasal spray bottle for you to make this easier. That nasal spray bottle will allow you to carry it around in your purse or pocket, so that throughout the day between neti pottings, if you start to sense congestion with some outdoor activity or exposure to an environmental allergen, you can spray as needed throughout the day. And so those are some easy techniques for getting it in. I think this is also a really easy way for you to get your autistic children to start onto Restore. As you guys have seen, the oral use, you have to start very slow in autism. Their guts are so perturbed and so out of alignment from a microbiome standpoint that they are going to have symptoms of realignment as you start Restore. And so the symptoms can be some bloating, some bowel changes. It can be psychomotor things like tics and hyperactivity, things like that in those first few days. And so starting at very low drops. But even there, we have practitioners that are finding that even 1 drop of Restore under the tongue, which is an incredible statement on just how off those guts are, with a single drop of this communication network from the bacteria, the whole system is resetting. For those patients that are that sensitive with oral use, you might want to start thinking about trying that in the nasosinuses and see if that doesn't help them. Just add your 1 drop or 5 drops to the neti pot rather than doing it under the tongue, and see what kind of reaction you get there, see if it's not better tolerated. Restore can be used topically as well, and so your eczema patients can spray the product right onto the eczema and have some pretty rapid relief. Again, eczema is a symptom of gut inflammation, so you don't want to just spray topically. But again, that for your super sensitives, topical spray onto eczema or other sensitive skin areas is another good way to get the body starting to adjust the microbiome and adjust the tight junction environment if the oral route continues to be problematic. So a simple spray on the skin or nasosinus spray, all of these are mechanisms by which you might want to try if you've got a super sensitive patient. Environmental toxins. As inflammation occurs, the gut and body tissues become like a sponge. And I don't have time to go into this today. We need to wrap this thing up here. But I really encourage you to go see Christopher Shade's lecture on Autism One website from Chicago in 2015. Christopher Shade is the biochemist that did a fantastic lecture on how your body, and once the tight junction injury starts and once inflammation occurs, literally these children are turning into a sponge for every toxin that's even trace present in their food chain. Lead, mercury, inflammatory proteins, plastics, and the rest. So he does a great lecture on that, so go check that out. Viral infections, toxins, bacterial infections and toxins, pharmaceuticals as we discussed, and then Lyme disease and mold toxins. All of these are things that we're going to be exposed to over our lifetime and can have a huge impact on accelerating that inflammatory cascade. Again, with Chris Shade, please watch his lecture to get a huge download on this Lyme disease and mold toxin effect. The short run, what you're looking for is restarting glutathione. Your glutathione antioxidant cascade is shut down by Lyme disease and mold toxin. Almost every autistic child is shut down in glutathione production. You need to release that at some point. So once you've been on Restore for a couple of weeks or months and the kid is up to a teaspoon a day or so with the product, then you're going to be able to start liposomal dim. Again, start slow, like 1 pump under the tongue. Do that for a week and then increase by 1 pump every few days until you're at your target dose. Run that dim for 2 to 4 weeks at the target dose and really clear up your child or your glutathione production through the DNA. So very exciting pathway there. And then optimizing the environment again, the obvious stuff, reducing plastics. Again, applesauce is being served in these plastic things that kids are sucking their applesauce out of. That is not good. The good old glass jar of applesauce is still the way to consume that stuff with a metal spoon and everything else instead of trying to suck it out of plastic and foil packages. Reduce heavy metals. Eat low on the food chain is, again, the answer there. Dental amalgams. The producers of amalgams always say on their product, do not put in children under the age of 12, and yet dentists across the world keep putting these fillings into children, and you guys are all aware of the problems there. So get the amalgams out if they're there. Do not allow amalgams to be put into children's mouths. Avoid using microwaves, as mentioned. Avoid processed foods. Assess the home for molds. Eat from your own backyard. Those are the quick ones to those environmental toxins. And ultimately, go back after the sinuses and gut for a total restoration process, and you're trying to not just tighten the gut, but everything beyond that. And so as the blood vessels tighten, you're going to get nutrient and water to the cellular targets, and ultimately you're going to get the toxins to get to the kidney, and the intelligent membrane held there can actually reduce the toxin load for the child. This is not chelation. This is actually healthy, normal processes of detoxification through normal kidney pathways. Slow and steady is that passion of detox. Is that the quick overlook? I'm going to turn it back over. We've got a year of Restore to get out to a family and get you started on that. And so we'd love to see that participation. Thank you guys for being with us, and we sure appreciate your efforts in being part of our community at Restore and Biomic Sciences. Thank you, Allison and Helen.
Hi, we are back. And so I think we've got time now. Helen, how many questions, how much time do we want to set aside for questions now?
Well, let's go and see. Dr. Bush, you tell us when you have to go. Do we want to give away the Restore first, and then we start with questions?
Yeah, let's do that.
Okay.
Okay.
Helen, I have a winner here.
Wonderful.
Vishal Patel. So if you can just email us, Vishal, we can get you your supply of Restore. Congratulations. All right, Dr. Bush, the first question I have is, will Restore help address oxalate issues in our kids because a low oxalate diet restricts some healthy vegetables, fruits, etc.?
Yes, great question. So many healthy things, when you have that leaky gut, become a problem. And so oxalates are a great example of what should be a healthy food source can become problematic when you've got that leaky gut. So the long-term answer to that one is absolutely. We really look forward to all of your children expanding their dietary spectrum very quickly after starting Restore. So usually within days to weeks of you getting your child to target, which would be around a total dose of a teaspoon a day, and so ultimately you're going to get them up to higher doses, but eventually you're going to get to a point where you're on a teaspoon total dose a day, and at that point I would start to really expand the diet. And so the dietary expansion there can include the oxalate-containing vegetables in small doses, and then just increase it incrementally. And so both frequency and dose can increase pretty quickly as your child tolerates. But absolutely, you should see not just oxalate levels, but other things like your amino acids that have been recognized to be problematic in your autistic kids. Things like glutamine and things like these can, again, be seen to clear in normal fashion once you've got that vasculature back intelligent again. So lots of tolerance where previously there was intolerance.
Okay, I think I know the answer to this one, but it comes from a health coach, and she wants to clarify for her clients. She's a health coach and has many adult clients that have newly discovered allergies and sensitivities to foods. Does Restore work just as well for adults with allergies as kids?
Absolutely. Yeah, we see it work well across the age spectrums. We have 85-year-old patients, 95-year-old patients that will start it and say, wow, that's the best gut function I've had since I was a kid. So it can work at any age, but I think it's fair that the kids get the easiest bang for the buck. Tiny doses in children can go a huge long way, whereas your adult population is typically going to require the higher teaspoon to a tablespoon a few times to get it managed. A good example of this is an incredible athlete that I take care of in Virginia. He's actually from North Carolina, but he drives up a few times a year to see us, and his severe asthma has kept him limited in his function. He is now asthma-free and off his 4-drug regimen since about a year and a half ago. He titrated his own restore dose. He ended up finding the dose that he needed to completely stabilize the membranes and reduce his bronchospasm and asthma and wheezing. The dose he found was 2 tablespoons 3 times a day. So that's an example of somebody who required a whole lot of it to get things completely under control at the membrane level. So it can be that high of a dose in your adult population, but again, your children, usually very sensitive and easy to treat, takes very low doses.
Awesome. Okay, here's another question. Sleep quality and inflammation were just mentioned. I have a child who wakes nightly and is treated for immune issues with IVIG. Would giving Restore before bed be a good idea, and how long do people typically see a change in sleep quality so we know it's helping?
Yeah, so before bed's not a bad idea for Restore. What we're seeing again and again is frequency of dose is probably more important than maximum dose. So I'd rather have you treating your kiddo 4 times a day with a small amount than a large amount once a day. So if you're doing it before meals plus bedtime, I think that would be fantastic. But I wouldn't say boil it down just to a bedtime dose. So keep it frequent as you can. So as you start titrating up from 1 to 5 drops under the tongue, instead of going from 5 drops to 10 drops, go 5 drops twice a day, then 5 drops 3 times a day, 5 drops 4 times a day. That kind of pattern would probably be more useful clinically than just trying to rapidly increase your single dose.
Okay. Should Restore be shaken first if I see sediment? Can mold grow?
Mold does not grow in Restore. Restore actually has an incredible antimicrobial effect, and so in the bottle, bacteria and molds have a very difficult time even growing near the Restore. Where we can see mold sometimes happen is on the cap, especially if you're drinking out of it. So we recommend you don't drink from the cap. If it's not bathed in Restore, then certainly bacteria and mold can grow on any plastic surface. So keeping those things clean. If you have any questions or concerns about the cap and its health, then I would just keep it in the fridge. But the sediment in the Restore is totally normal. That is the mineral content. If it's not shaken consistently over time, that mineral content will start to sediment out. We have bottles that have sat on shelves for many years now, and they continue to test normal laboratory experiments for the tight junction effect and the reactive oxygen species effect of the mitochondria, etc. So it remains a useful product and complete function, even though the sediment has come out of it as it sits on the shelf.
The next question is, how long does it typically take for the gut to normalize after taking Restore for a kid who's on gluten-free, casein-free, soy-free diet for almost 2.5 years?
We see the effects of the tight junction happen under the microscope within seconds of introduction, really, so it's very, very fast effect. We see that clinically happening within minutes to hours, and so it's a very impressive, fast response in every gut. The issue is not so much have you fixed the tight junctions yet, it's got to do more with how much inflammation is behind that membrane. And for that reason, I can't answer that as a single answer because the timeline is going to be highly variable. If your kiddo has been on a gluten-free diet for many years and is asymptomatic, then it should be only a matter of weeks to days to months before you're having great success with broadening that diet. But if your kiddo has been gluten-free and has still a lot of symptoms, it still has a lot of inflammatory signs both in the nervous system and the brain as well as in the gut, then that patient is going to inherently be slower to settle all of that sensitivity and allergy type profile in the gulp. So the tight junction effect is almost instant. The amount of inflammation behind that in the gut is going to determine how long it is until you're in a really relieved state or subclinical state with that inflammation.
Okay. How does the immune system overload in this context relate to mast cells? Histamine being released in mast cells triggering a mild or severe reaction to a variety of items.
Great question. So mast cells are the little bags, if you will, they're the little sacks of histamine. A mast cell is covered with or is attached to an antibody called IgE. That IgE is the same shape and size as the antibody type that we call IgG. IgG antibodies are the majority of the antibody made in the body. The majority of the antibody made in the body. It's hard to say fast. But the IgG antibody, once tagged onto a mast cell, becomes an IgE. And so what happens is you'll bind that antibody to an antigen, and so something like a peanut oil or something like that is hit by that, or peanut protein is hit by that antibody, and immediately degranulation occurs. That's the phrase we use, or the term we use for the release of that that little spiral of the histamine into circulation. And so IgE is the antibody that's formed in the gut and releases the histamine.
You say in your notes we can't give iodine near giving Restore. How far away from Restore can we give iodine?
Yeah, within minutes. Restore is a very fast one to absorb, and it probably would have no effect, but it's one of those iodine is a very charged mineral substrate there, so putting any highly charged substance next to Restore has the potential to diminish the efficacy of Restore, but it's certainly not a contraindication to it, so it would not worry me if you were taking it at the same time per se, but I think there's some rationale to saying, well, I'll just space it out by a few minutes at least. And so if you're taking Restore before your meals, think about taking your iodine at bedtime, something like that.
Okay. My child is starving because the blood tests show allergies to so many things. Are you saying that eliminating those foods is not necessary? He has fetal alcohol syndrome and was meth exposed. We've done everything we know diet-wise for 8 years, but can't get him fed right and absorbing nutrients. We don't use any pharmaceuticals.
This is a very intense situation. I have a number of children in my clinic that fall into this category that are very heavily affected by profound leaky membranes and from birth have been dealing with an enormous amount of sensitivity and allergy of the gut lining and beyond. These patients can be so profoundly affected that it can simply take a great amount of time to be on Restore before you see them getting into some sort of normal ballpark where you can actually recognize reduction in inflammation. In these cases, I highly recommend that you have a practitioner that's really well versed in the gut immunity to be following along. You're going to want blood tests that are looking at total IgG, total IgA levels, kappa and lambda light chain immunoglobulins measurement probably as well, and then finally the HS or high sensitivity CRP. So a number of different blood tests should be followed in a child that's that heavily affected, and that's going to help you understand Restore. So as soon as you start Restore, you'll start to see those antibody levels falling, immunoglobulin levels falling, all of that, and you're going to see those in the blood tests much sooner than you're going to see the clinical results. So you are going to be expanding the diet of that child, and you want to be following the blood test so that you can reassure yourself that, okay, inflammation is going down despite the fact that I'm increasing the variety of food going into this child. And you're going to need that reassurance because these kids are so difficult to tell what's going on because they're so far out the normal ballpark of immune modulation. So to get a physician involved or a practitioner that can follow those blood levels for you.
Okay. How do you know that Restore actually gets to the gut lining once it is swallowed? I understand in a Petri dish it works. Do you just judge by symptoms or do you take biopsies? I have been using Restore since June with great results.
We don't do biopsies in general at all. Biopsies have historically been very inefficient and not incapable, unsensitive at judging the amount of leaky gut that we have. The functional tests we think are better. Historically, there's been the oral mannitol study that can be done. You can have that ordered through a lab where you drink a large carbohydrate molecule called mannitol. And you can watch the urine levels of the mannitol go up if you have leaky gut. The mannitol should stay in the gut entirely if you have an intact tight junction membrane. So that's been used historically, but it's a clinical study, and I don't think it actually works real well clinically. So in general, we don't go after biopsy or functional studies clinically. Instead, you can follow the syndrome very carefully with the test that I actually just mentioned in the previous question. So if you really want to know if your gut is starting to heal up quickly and it's working in you, then following total IgG, IgA levels, CRP levels, all of those are really effective methods for demonstrating in your own body. We've been using Restore in clinic now for almost 4 years, and we have innumerable studies now showing that antibody drop in a whole host of conditions. Not because Restore treats any of those conditions, but because Restore shuts that front gate and increases the clearance of the kidney of toxins. So really potent 1-2 punch of stop the leak and get the clearance going, and you are going to see a drop in those inflammatory markers and overall immune stimulation happen. So if you want to trace it in yourself, get some of those blood tests.
Okay. I have dozens of more questions here, so do you have more time or do you want to stop? You tell me.
Yeah, you can keep going for another 5 minutes here, so let's keep going.
Okay. Is this safe for a breastfeeding mom? My 4-month-old baby has sensitivity symptoms, spitting up diaper rash to peanuts, almonds, chocolate, and eggs.
Yeah, so it's used a lot by breastfeeding mothers. So we have a lot of moms who have used it successfully during breastfeeding to reduce the sensitivity of their child to whatever they're eating. Mom's eating the peanuts or the chocolate or whatever it is, and that seems to then cause a atopic dermatitis or sensitivity reaction around the mouth of the child, or thrush or other signs of dysbiosis. Certainly, mom getting her gut healthy and working on that avenue is one way to do it. But we are also recognizing that there's a lot of glyphosate in breast milk now, and so treating the breast itself just topically with a few drops of Restore is an easy way to do it. So right before nursing, a few drops of the product onto the nipple and let the child suckle that with the breast milk can reduce that sensitivity reaction. But if you've got any questions beyond just kind of the dietary sensitivities, I would definitely check with a pediatrician and have them evaluated to make sure that they don't already have more of an allergic paradigm. Certainly after 6 months of age, starting to think about antibody testing is something to consider if your child's got anything other than just mild kind of atopic dermatitis around the mouth or something like that.
Okay. If someone has addressed MTHFR and other SNPs with supplements, is it likely some of those can be omitted after using Restore?
Yeah, exactly. So MTHFR is such an interesting fad right now in functional medicine and in kind of integrative clinics. All of my patients who come in saying, I just tested positive for MTHFR, majority of them have chronic fatigue or chronic pain syndromes or some other reason that they obviously got tested. But the interesting thing is when you talk to them, they didn't have any symptoms of the fatigue or pain or whatever it was until 1998 or 2005 or whatever it was. And at that moment, they had been put on antibiotics for some reason, and whether someone got traveler's diarrhea, came back, got put on Cipro, whatever it was. And so you can almost always track those MTHFR patients back to an antibiotic exposure that led to their syndrome, that led to the testing in the first place. And so it's important to realize that even though there's a genetic truncation or whatever in this population for this methylation pathway, they did absolutely fine through life until they lost their bacterial biome. And the reason that is the truth is because 90% at least of the enzyme activity in the body, methylation, etc., is not done by the human cell at all. It's actually done by bacteria. And so bacteria are your workhorse from an enzymatic pathway. The bacteria are what methylate your oral sources of things like B12 and things like that. So all of the methylation should really be happening outside of the human genome. And when you suddenly see your biome gone, then suddenly you start to rely inappropriately on the human methylation pathways, and that's when you start to reveal a segment of the population that has MTHFR defect. And so the short answer to that question, I would say, if you get your biome fixed, your methylation activity is definitely going to be back up and running in a much more robust fashion, and it's very likely that all of your methyl B12s and all of that are going to be less important as for long-term usage.
Thank you. Okay, is it safe for children with ulcers or known lesions?
I'm sorry, read that one again?
Is it safe for children with ulcers or known lesions?
Ulcers and what's the last?
Lesions, I guess.
Lesions. Ulcers and known lesions. I wonder if they're talking about in the gut there. So
I would say in the gut. Yeah.
Okay. So is Restore effective with patients with ulcers and gut lesions? Is that the question?
Yeah.
Okay. Yeah, so something like a gastric or peptic ulcer or duodenal ulcer being more common, these are real macro inflammatory events happening. And so you've got a whole lot of breakdown of communication at the cell membrane level. You've completely lost normal cell repair processes. And so a patient like that is going to be much longer term, and you're going to use a lot of other efforts, most of all around nutritional modification if you've got ulcerations and chronic gastritis, for example. And so they usually are very underproducing of acid, and so this would be one area that I would certainly promote using like an HCl with betaine or something like that for at least a month or two in conjunction with Restore to support the tight junctions and reduce inflammation in the gut, etc. So HCl with betaine would be a go-to. L-glutamine might be something you reach for as well as an adjunct to the Restore. Certainly doing a lot of the coconut oil and other membrane support systems like we talked about earlier in the talk would be something to manage. It's important, again, to remember that Restore doesn't treat that ulcer. It's simply reducing some of the kind of root causes of why it occurred. And so you're going to want to really make sure that there's not everything else we talked about going on. NSAIDs, alcohol, the polyunsaturated oils, gluten, all of those insults, eat organic, all those become really, really critical because, again, all of those probably had to be present for these kids to, or at least some of those had to be present for the kid or the adult to get to the point of complete ulceration of the bowel.
Okay, I'm going to give you one last question. We are 9 weeks post-stem cell treatment. We have seen tremendous gains. Would Restore be a complement to stem cells?
Yeah, so the stem cell story is amazing and continues to evolve quickly with Restore. We have a nice human trial showing that 2 hours from first dose of Restore, there's a 20% increase in stem cell activity in the urine. So really rapid upregulation of systemic stem cell markers within your first dose of Restore. And so the bacterial population and the communication chain coming from it, and these redox molecules seem to be critical in not only the activation but also the support of and maturation of these stem cells. So I would say absolutely there's some good clinical data now saying that anytime you're thinking stem cells, Restore is going to be part of that anti-aging kind of effort.
All right, we have a follow-up to the question about the ulcers. So the clarification was yes in the gut found on a colonoscopy, like say like a Krigsman patient or something like that. And because these would be maybe pre-verbal kids, would you expect pain?
Would you expect pain?
Yeah, when taking Restore.
No, not really. I mean, the pain is not going to be specific to the ulcer at all. So an ulcer actually will be soothed by Restore from a symptomatic standpoint. If they're having pain, it's probably completely unrelated to the ulcer itself and more related to the underlying reason why they have an ulcer, which is an abnormal gut microbiome. Anybody who has sharp gut pain or migratory pain with taking Restore has got a very high likelihood of having a parasite on board. If you have ulceration in the colon, very likely they have a parasite on board. And so for somebody who has colonoscopy, especially a child that's pre-verbal who's colonoscopy evidence, I'd be all over a parasite cleanse on that patient there. So get that one on a parasite cleanse. I usually just use the old Hello Clark regimen with clove wormwood and black walnut oil. You do something like 30 drops twice a day in water, 10 days on, 10 days off, 10 days back on. Usually start that on either the noon moon or the full moon regimen there. So that'd be, I think if that's in the colon, not up in the upper GI tract, you just moved my suspicion from bacterial overgrowth to a parasite. So I'd go after the parasite pathway there.
Thank you. Okay, I think that's it in terms of questions. We're going to wrap up. But thank you guys very much for attending. Thank you, Dr. Bush, for answering all of our questions and for presenting today. We will have the recording available. Just give it till tomorrow so we can get it out to you guys. But if you registered, it will go right to your email. And there are a ton of people PMing, thank you, thank you, thank you, down the line. So there you go. Thank you so much. Have a great
Thank you, TMR. You guys are amazing. Keep up the great work out there.
Bye.